So when I look at retirement, some of the things that I as a planner am concerned about, what are the red flags? What are the things that could derail your retirement? We talk about expenses, unforeseen expenses. Unforeseen expenses is in medical. A lot of medical can be taken care of through Medicare, so on and so forth, once you turn 65. However, one thing that is a big concern is long-term care. Statistically, 70% of people live over the age of 65. 7 out of 10 people will need long-term care. The good news is we're living longer. However, that means we have to stretch our assets longer. That means we might need long-term care as well. Long-term care is not long-term disability. It is ongoing services needed because you have chronic health condition or you're disabled. Where can you receive care? At home, at an assisted living, senior living facility, at an adult daycare center, or in a nursing home. A lot of times I get the question, does this pay for, like an assisted living facility? Yes and no. I mean, essentially, if you qualify through what we're going to talk about, needing assistance. If a person just wants to move into a senior facility and they're fully capable of taking care of themselves, the insurance wouldn't pay. So let's talk about the costs. The average nationwide cost is $74,000 per year. So this is why this can derail a retirement. So how do you pay for it? Well, if you didn't plan, it's going to be out of pocket. So it'll be out of your nest egg. You can rely on the government. Medicare and Medicaid will pay for it. We'll talk about the pros and cons of that. And then you buy insurance to help you pay for those costs. So out of pocket. What are the pros to that? Well, if it's out of pocket, you can go anywhere you want to go. Obviously, the other thing is you'll be willing to liquidate assets if necessary. Running out of money is a big thing that could happen, and then at that point, you'll then be forced to either rely on a member of the family or using the Medicare and Medicaid that we're about to talk about. Many people didn't know that Medicare does cover a portion of long-term care, but it's not very much. It pays for only 3 days. You have to be in the hospital for 3 days. It'll pay full cost for only 20 days. And then it'll pay partial from 21 to 100 days, and then you're done. Medicaid is one that will pay. The only problem is that you have to get rid of your assets. It's not Medicare, it's joint federal and state program that pays for long-term care. It doesn't cover everything, only about 49%. And obviously, because it's the government doing it, they're picking the bed, you're not. So it was not going to be in an ideal place. They're going to find a bed wherever they have a bed, and that's where you're going to go. Each state has its own eligibility criteria. Income levels got to be a certain level, and then there's an income gap. Your assets, you can't own more than $2,000 worth of stuff, other than your home and one car. Let's talk about planning. This actually is a strategy. Some individuals want not to have to worry about this and want to pass on all their assets to their kids and say, I'm okay living with a house and a couple $1,000s and one car, and I don't care where I'm living at that point in time. If you're going to do this, you have to start planning ahead. You can't do it last minute when one foot's ready to go into nursing home. You can't do that. You've got to plan at least 5 years ahead of time. Pros and cons, you preserve your assets essentially. If you're going to use Medicaid, the reason for the strategy or for planning is to keep your assets. A lot of times, you worked all your life for your assets, and you don't want to just give it away to a facility. So this is one strategy that can be used. Drawbacks. Some people think it's ethically problematic. I'm not going to go give away my assets to my kids when I could pay for this. Some of the examples: you can transfer your ownership of your house to your son. If it costs $4,000 a month. House is worth $400,000, you're not going to be eligible for Medicare for 100 months. This is, for most, the way to go. Some of the reasons for it, obviously, you have the freedom to choose which provider, and you preserve your assets. For people that have assets between $250 and $3.5 million, you want to protect those. This is where you want to start looking. There's 6 activities called activities of daily living. You got to be able to bathe yourself, feed yourself, drive yourself, clothe yourself, and there's 2 others that I don't remember. But essentially, if you can't do 2 of those things yourself, you qualify for long-term care. Elimination period means how long are you going to pay for the expenses yourself out of pocket before the insurance kicks in? I have found that the sweet spot's about 90 days. That's whenever the premiums come down enough and it makes enough sense. So sometimes people say, well, I hate insurance. Why don't I just invest the money for the next 20 years? Instead, if you were to take $3,000 a year at 5%, after 20 years you'd have $105,000. Same thing in a policy, the three-year long-term care policy, compounded with inflation protection, you have $435,000 worth of benefits. So you'll see that you have almost 4 times, or you have a little over 4 times as much leverage by buying a policy than having the money invested and just using cash. Here's what you want to look at in order to manipulate this data, to be able to compare apples to apples. So benefit is how much, and it's usually priced per day or per month. How much per day do I want this coverage for? Typically, we're doing $150 a day. Benefit period is how long do you want coverage? I would go a minimum of 5 years. Elimination period is what we just discussed. How long are you willing to pay out of pocket? Location of care, most all policies these days will pay at home and in a facility. Location of care used to be 5 years ago, even between 5 and 10 years ago, used to be that it give you 100% benefit if you were in a facility, and they might only give you like 50% benefit if you were at home. But all the policies I'm seeing now are 100% both at home and in a facility. Inflation protection says that my $150 a day will equate to the same dollar 20 years from now. Managing the cost, obviously the younger that you are, the less expensive it's going to be because you lock in a lower rate. So make sure you can afford the premiums now in the future. Sometimes I'm looking at a person's budget and maybe they're at that $250,000 level and they're using every penny to kind of pay their expenses, and it's just not one of those things that I don't want you to be insurance rich and cash poor. Just know there's going to be some risks and you might have to give away your assets and use Medicare and Medicaid. If you're thinking about any of the planning that we've done, sooner rather than later is better because it's less expensive. Trust me that I've run into many cases where it's, my mom's in a facility, what do we do? And so at that point in time, our options are limited. There's not much we can do. I mean, I might be able to throw money into an annuity and say, get her out for a day and then put her back in. But I mean, the options are limited. At that point, we're talking spend down is what we're talking about. Spend down your assets and try and preserve as much as possible. Explore the cost. Whenever you are starting to make these considerations, obviously talk to your spouse or family about your plans and kind of healthcare directives. I mean, along with, this is a long-term care class, but it's really important for a retirement plan that you have all your healthcare directives in place. I think that's it. Thanks for coming in. I hope this was informative. As always, if this is something that you're considering now, we'd be happy to visit with you guys and run some numbers and see if it's feasible and see which direction we should go.